The next speakers are Professor Thomas Mettenleiter and Professor Wanda Markotter, co-chairs of the One Health high-level expert panel. Dear Wanda and Thomas, One Health is a fundamental principle of the Rome Declaration. That means looking after not only human health, but also the relationship with animal and environmental health. Please, you have the floor.
As one of the two founding, great pleasure and privilege to inform you about the establishment of the One Health high-level expert panel, whose inauguration session has taken place on Monday, May 17th. This panel is the result of an agreement between WHO, OIE, FAO, and UNEP, recognizing the need for a global center of expertise to connect and communicate on issues related to One Health, the interaction between human, animal, and environmental health. The current pandemic has shown it clearly that One Health approaches are required not only to analyze and understand the emergence of novel threats by pathogens, resulting in devastating global crises such as the SARS-CoV-2 pandemic, but primarily to be better prepared to counter, control, or at best prevent the next pandemic situation. Thus, the panel is expected to provide guidance on One Health-related matters that support improved cooperation among governments, support the work performed by the partners in the framework of the One Health collaboration, and executes an advisory role to the partners. The recommendations of the panel will be based on scientific evidence to be reviewed by the panel members. The 26 panel members have been selected from more than 700 applicants by the 4 mother organizations, representing a broad base of expertise. 1 week after the notification of appointment, the first session of the panel was scheduled. So we are getting started as rapidly as possible. I now hand over to my colleague, Professor Wanda Markotter, the founding co-chair. Wanda.
Your Excellency, ladies and gentlemen, it's an absolute pleasure to address you as the co-chair of the newly established OLED panel. We already had our first meeting on 17 May, and the panel is represented by all expertise needed for a One Health approach globally. It includes representation from the environment and social sciences. As a start, we aim to document and analyze One Health approaches to really understand what has been successful and what not to do in the future. Where are the bottlenecks? What do we really know on the ground? And identify the gaps and how we can go forward and go forward practically. This expert advice will be shared with the partners so that they can use that strategically going forward. It will also maximize the use of resources if we stop working in silos and instead work together between sectors and disciplines to address the same problems. The One Health approach, stating that human, animal, and environmental health are linked, is not new, but it is now even more urgent to translate into action. It must change people's lives. Discussions, recommendations, and actions amid this pandemic, but also going forward and thinking about preparedness, must address this as one concept with each aspect equally important. It is not just about pandemic preparedness, but it is much more far-reaching. It will create a healthier ecosystem for all, addressing several other concerns like biodiversity loss, climate change, food security, and social inequalities. So there are advantages in using this approach to prevent future pandemics, but even more so for overall improvement of health and for all, to be available for all, and sustainable economic stability and resilience.
Thank you so much.